Good morning. As a hospice nurse, the question I am asked the most about caregivers and patients who come onto hospice, and I'm sure other hospice nurses will concur, how long does my loved one have? And that's a loaded question. Typically when somebody comes on hospice, we meet them where they are. Some people come in very poor and almost in the dying phase, where we would see symptoms of maybe restlessness, agitation, very, very poor oral intake, and they become having active symptoms of dying pretty quickly. Other people come on pretty okay, if that's what you want to call it. You know, they're ambulating, they're cognitively intact, and we'll say, well, they're not in the dying phase by any means now, but as things change, we'll let you know. And some patients want to be totally in on it, and other patients do not, and we speak to the family members. So we would expect somebody on hospice, since it is comfort care, if they stop treatment and with disease progression, they will decline. And people don't typically show signs of dying until maybe 3 weeks before they die. Some people experience symptoms of restlessness, agitation. Others do not. And as symptoms come along, we manage them. There's always something that hospice can do to relieve symptoms. But typically what we do see is people sleeping more and eating less. And that is to be expected. As people progress into their dying phase, we would expect them not eating at all and sleeping mostly. Dehydration is a part of the dying process. And at that point, if somebody is basically comatose, no PO intake, we would expect a low blood pressure, high heart rate. And then we could say your patient has maybe hours to days if somebody's in the active dying phase. Besides that, I say, listen, we don't have a crystal ball. We can manage the symptoms. But when it comes down to the active dying phase where all these symptoms are present, we could, I think, comfortably say hours to days. And the bottom line is, I saw people that I did not expect to die who've died. I have seen people that I said were in the actively dying phase who have lingered much longer than I had thought. So the bottom line is, when your soul is ready to leave your body is when you are going to die. And it is up to us as hospice staff and your families to support you during that process. I hope that helps. The more you know.